All right, today we're going to talk about something that, honestly, millions of people deal with every single day: gastroesophageal reflux disease. Or, as most of us know it, GERD. We're going to get right to the bottom of that uncomfortable burn and figure out exactly what's going on. You know the feeling, right? That uncomfortable, rising heat right in your chest. Maybe it hits you after a big family dinner, or even just after your morning coffee. Well, that sensation is heartburn, and it is the absolute hallmark symptom of what we're digging into today. Yeah, when you boil it all down, this is pretty much it. Your digestive system is supposed to be a one-way street, right? But with GERD, you've got traffic going completely the wrong way. So in this explainer, we're going to figure out why that happens and what you can do about it. Okay, so let's get just a little more technical for a second. What are we actually talking about when we use the term GERD? So here it is, the official breakdown. It all comes down to this one really important muscle called the lower esophageal sphincter, or LES for short. Just think of it like a little valve. Now, when that valve gets weak or doesn't close all the way, stomach contents and all that powerful acid can flow backward into the esophagus, and your esophagus is just not built to handle that. You know, the best way to think about the LES is like a gatekeeper. It has one job: control the opening between your esophagus and your stomach. But, as we're about to see, sometimes that gatekeeper gets a little lazy on the job. This is such a great comparison. So on the left, you've got a healthy sphincter. It's a nice, strong, secure gate. It opens to let food through, and then it snaps shut. But on the right, for someone with GERD, that gate is weak. It's kind of floppy. It's like a faulty seal, letting all that acid splash right back up where it really doesn't belong. And you can see how this just sets off a domino effect, right? It all starts with that weak gate. That allows the acid to reflux or flow backwards. Now, the lining of your esophagus is super sensitive, so it gets irritated and inflamed. And that inflammation is exactly what you feel as heartburn. It's a very direct cause and effect. So this leads to the big question, right? Why? Why does that gate weaken in the first place? Well, it turns out there are a whole bunch of factors that can contribute to GERD, and honestly, a lot of them are surprisingly common. Just take a look at this list. Some of these make a ton of sense. Things like obesity or pregnancy can actually increase the physical pressure on your abdomen, literally pushing acid upwards. Then you've got things like smoking, alcohol, and certain foods that can cause the LES muscle itself to relax. And get this, even something as simple as wearing tight clothing or eating too close to bedtime can set the whole stage for reflux. Now, it's really important we pause here, because GERD in infants and children can look totally different. So for any parents watching, this next part is for you. See, in babies, the problem is often just that their LES muscle hasn't fully developed yet. It's still a little immature. So instead of that classic heartburn, you're going to see different signs. A lot of spitting up, being really fussy and irritable after they eat, or maybe even refusing to eat. And that distinctive back-arching thing you might see, it's a classic sign they're trying to get comfortable and relieve that burning feeling. Look, while heartburn is really annoying, the real reason to take GERD seriously is that when it's chronic and untreated, all that acid reflux can lead to some pretty significant long-term health problems. This is about way more than just temporary pain. This timeline here shows how the damage can actually progress over time. It starts with esophagitis. That's just a fancy word for inflammation. If that continues, it can lead to ulcers and even bleeding. All that constant damage and healing can also create scar tissue, which can cause the esophagus to narrow. That's called a stricture. But the most serious risks, well, they're at the end of this path. And this is the crucial point. Long-term acid exposure can literally change the cells that line your esophagus. This condition is called Barrett's esophagus, and it's considered precancerous. Now, let's be clear. The overall risk of it developing into cancer is still pretty low, about 0.5% per year, but it is a significant increase, and it's exactly why managing GERD is so important. But here's the good news, and it's really good news. GERD is highly manageable. So let's shift gears and talk about the practical toolkit, the actual things you can do to control your symptoms and prevent those long-term complications. The foundation for managing GERD almost always starts with lifestyle, simple things. Reducing weight takes that physical pressure off your stomach. Quitting smoking can help the LES muscle function better. And look, even simple stuff like wearing looser clothes and not having a huge meal right before you crash can make a world of difference. Next up is diet, and this is all about figuring out your personal triggers. For a lot of people, that's going to be spicy foods, fatty foods, chocolate, coffee, citrus, alcohol, you know the culprits. Another great strategy is to switch from 3 huge meals to smaller, more frequent ones. That just helps keep your stomach from getting too full and putting pressure on that faulty gate. Okay, this next tactic is basically just simple physics. You gotta use gravity to your advantage. Staying upright for a couple of hours after you eat helps keep everything down. And the same idea applies when you're sleeping. If you can prop up the head of your bed, just a few inches with some blocks or a wedge pillow, you can stop acid from flowing back up while you're lying flat. It's a game changer for many people. Now, of course, when lifestyle changes just aren't cutting it, there are excellent medical options. Things like antacids, your Tums or Rolaids. They offer really quick relief by neutralizing acid that's already there. The next step up are things called H2 blockers, which actually reduce how much acid your stomach makes. But as you can see highlighted here, the most common first-line treatment are drugs called proton pump inhibitors, or PPIs, and that's because they are the most effective at really shutting down acid production. And then for really severe cases, there's even surgery to physically tighten up that faulty gate. Phew, we've covered a lot, right? The what, the why, the how-to of GERD. So after all of that, what's the single most important thing to remember? It's this: you have way more control over this condition than you might think. Once you understand that the root cause is a mechanical issue, that faulty gait, and you start identifying your personal lifestyle and dietary triggers, you are empowered. You can take the first, most important steps toward feeling better. So I'm going to leave you with this final thought. Based on everything we just talked about, what is one small, totally manageable change you could make starting today? Maybe it's just skipping that late-night snack, or swapping 1 cup of coffee for an herbal tea. The path to relief really does start with a single step.